Today I'm sitting with Dr. Margaret Blaustein, who is the co-founder of the ARC Treatment framework, which fosters resiliency in children who are experiencing traumatic stress. The ARC model focuses on attachment, self-regulation, and competency in order to try to use these key elements to foster that resiliency in children and adolescents. Can you talk briefly about what the ARC Treatment framework is?
So the ARC Treatment framework, which is, as you said, it stands for Attachment, Self-Regulation, and Competency. I co-developed with Christine Kinneberg, and it's a flexible components model for working with children and families who've experienced more complex or chronic traumatic stress.
Margaret, can you tell me what you mean by traumatic stress?
So, it's sort of always kind of the million-dollar question, and it starts with the question of what trauma is exactly. And it's really hard to define, what trauma is. We tend to think of trauma as an overwhelming experience, so something that overwhelms a child or an adult's ability to cope. And obviously that can be such a subjective experience, because what's overwhelming for a 5-year-old may be very different from what's overwhelming for an adolescent or for an adult. And it depends a lot on what they have available to cope, what resources they have. But in general, when we think of trauma, we can think of either acute events, so things that happen one time, like a car accident or an assault of some sort. Often the work I do is with people who've experienced more chronic adversity or more chronic stress. So things like physical or sexual abuse, neglect, exposure to domestic violence, and then a lot of the more subtle adversities like extreme poverty or living in a community that has a lot of violence or housing instability, racism, things like that that really take their toll over time on someone's development.
What are some symptoms caregivers might look for if they're concerned that their child might be experiencing traumatic stress?
And again, there's really a range of outcomes because there's such a variation in what trauma is. And so that means there's variation in what trauma does to kids. With more acute traumatic experiences, again, like the car accident or sort of the one-time experiences, we're looking more for symptoms of post-traumatic stress disorder. So that tends to be a lot of intrusive re-experiencing memories of things that happened, hyperarousal, so the body staying kind of revved up in response to that danger experience, and then a lot of times avoidance or numbing, which is the child's attempt to kind of shut down. With kids who've experienced more chronic trauma, and again, that's really what ARC was designed for, we're often seeing a real developmental impact across domains. So one of the biggest impacts we see is a very core dysregulation. In other words, the child has trouble managing emotions and body experiences, and often managing relationships over time, managing their behavior as a result of all of that. We see kids who struggle a lot with relationships and with trusting other people. And, again, a range of different challenges with development. The flip side of that, I tend to think our kids put their energy into surviving. And so while they have a really hard time with some of the more normative developmental tasks that are less relevant to their survival, they get really good at the stuff that's helped them survive. Unfortunately, that stuff is what often then gets in their way over time because they're very good at picking up on signs of danger, even when there might not be danger around, very good at protecting themselves, but maybe that prevents them from developing close friendships. So kids adapt to their worlds in ways that make sense.
I know it's important to help caregivers be able to recognize the emotional needs of their child as well as their own emotional needs. Can you talk a little bit about what triggers can look like in children who are experiencing traumatic stress?
So one of the sort of foundations of our framework is the importance of working not just with the child, but with the surrounding caregiving system and really building that caregiver's understanding of what's going on for kids, because kids can be really confusing. Triggers, which is what you're mentioning, are something that can be hard to understand. So a trigger, what is a trigger? We use that word. It's really kind of a push button. And what we think of it as something that is in some way a signal of danger for a child. It's not just reminiscent of an experience in the past, but it's something that says to the child, I might be in danger right now. Okay? And it happens really super quick. So the child's brain says, I might be in danger, and they have a very strong emotional response. And often it can be as subtle as a facial expression or a feeling the child has in their body, feeling threatened by someone, and they go into sort of the danger response, which is that high arousal. We think of the fight, the flight, the freeze, right? So the high arousal, or taking off, trying to get away, or really shutting down and seeming kind of frozen or stuck. And for caregivers, for the range of adults who are around kids, not just parents, but for teachers and therapists and other people who come into interaction, it feels really confusing because all of a sudden you're talking to a kid and they've had an explosion, or they've escalated, or they've shut down, and you can't figure out why or what's going on. A big part of the work that we're doing is really helping caregivers understand what triggers are and how to understand them, so that it feels a little less personal when your child is suddenly in an explosion for something that feels really minor.
What can caregivers do when their child is triggered?
Yeah, it's such a hard thing because, often what we have is the child is escalating or shutting down and feeling these intense emotions, and it's almost impossible for a caregiver to not in that moment also be feeling that intensity. When a child's behavior gets out of control, when they get really aggressive, when they, suddenly are gone and spacing out. We talk with caregivers about sort of a sequence step, knowing that it's never this easy, right? And so it's starting with what are the concepts that we want to try to work on, and knowing that it takes a lot of practice to get there. And the first thing we want caregivers to do is keep themselves calm. And it sounds almost like a silly first step, but that checking in with yourself, if everything around you is kind of exploding, taking that pause to say, all right, I got this, and to take a breath. In the moment that a child is really escalated, the part of their brain that's in charge isn't paying a lot of attention to language. And so a mistake we can make is to do too much talking, to get in, to try to be really logical, to be punitive and start saying, oh, you're going to do this, and if this happens, then this is going to happen next. Or to try to retake control. To step in and be the person in charge. The problem with all of those is that if you use too much language, the child can't hear it because they're not in the right mental space. And if we step in and try to take control, it can actually increase the child's feeling of danger. So what we want caregivers to do is, again, start with that pause, tune into themselves, really simply reflect what they're saying. I see you just got so frustrated. Right? And then try to support the child in using some sort of coping skills, some modulation skills. Ultimately, what we want is the child's body to re-regulate, and we want to help them feel a little bit safer and back in control. So instead of taking a step in, you take a step back, right? And you say, let's think about what we can do to calm down. And you give a little bit of choice. So you can try this, and I can stay right next to you, or I can step right over here. And it's not all the choices in the world. We want to stay safe and help kids stay safe. But we're trying to reestablish for the child some feeling of control in that moment. And then we do all the talking and processing and, sometimes setting limits if the child's gotten so aggressive that, dangerous things have happened. But all of that happens after the child has calmed down. It can't happen in that moment because otherwise we're just really exacerbating the situation.
One thing you talk about in your model is the impact that a caregiver's own affect can have on a child's emotional response. Can you talk about that dynamic?
Sure. It's one of the most challenging things about relationships is that we're actually in relationship, right? Which means that what I feel is going to affect the person who I'm in contact with and in relationship with. And there's no way when kids experience all sorts of stress and have their own normative reactions to it that caregivers won't themselves experience their own emotional responses. And again, part of that is in response to kids and what they're doing, and part of it is because a lot of the times when our kids go through adversity, the adults have also gone through adversity. Not always, but a lot of the time that comes together. And so we find that kids will have their emotional responses or their way of being in relationship, and caregivers will have their own normative kind of reactions to that or self-protective responses. And this is particularly complex with trauma because kids who have been hurt in relationship often play out that hurt in later relationships. So for instance, if you have a child who's been rejected over and over and over again, and now they form a new relationship with someone else, they go into that relationship expecting to be rejected. And they're going to act in a way that kind of pulls for that. Now, if I'm the adult in that interaction and I have a child who's continuously not trusting what I say or reacting in kind of an angry way to what I'm doing because they're waiting for me to hurt them, at a certain point, I'm going to start feeling, gosh, I don't like this at all. I don't like how this feels. And I'm going to have my own responses. And ultimately what may happen is that I actually reject that child. So there's sort of in some ways, a self-fulfilling prophecy that can play out, but it's very much a parallel process, which is one of the big reasons, part of it is that it's hard to feel all this stuff for caregivers, but one of the big reasons that we want to pay attention is so that caregivers are able to really tune into themselves, take care of themselves, and respond from kind of a more grounded place.
So when traumatized children become triggered, this can also obviously be stressful on a caregiver. Can you talk a little bit about how the caregivers can tune into themselves?
Right. There's so many things that can be stressful for caregivers. Parenting in general is stressful, right? And parenting a child who's experienced trauma is particularly stressful, and even more so when the parent themselves has also experienced adversity and stress in their lives. So we have multiple layers there. And to be able to kind of manage that experience, the first step is to know that it's happening. So just like with kids, we're teaching them to be aware of what's happening in their bodies and to do something with it. We want to support caregivers in doing the same thing. And there's a couple different things that we look for with caregivers. One is specific push buttons. So what are the things that in particular may be harder for me if I'm the caregiver to manage in my interactions? It may be I do really well when my child is sad, but when he gets angry, it reminds me of other times that people in my life have been violent, or I worry that he's going to become violent. And so in that moment, I shut down and I react in a different way, right? So it may be particular dynamics that the caregiver finds harder. It may also be vulnerable times, like normally this is a caregiver who does very well, but when they're very tired and stressed out by things going on at their job, and their patience is wearing thin, they have a harder time managing their emotional experience. So we want to work with caregivers to recognize what is it that might make me more vulnerable to emotional experience, just like it might make anyone more vulnerable to emotional experience. Now, it can be hard to always know what your push buttons are or whether or not you're in one of those vulnerable times. Half the time we're in them before we recognize that we're in them. So one of the big things we work with caregivers around is how to recognize their own clues that something's kind of going south. So it could be a feeling you have inside, it could be a behavior. It's suddenly I'm yelling at everyone, and that's my clue that maybe I'm on edge a little bit and I need to take a breath and step back. But really what we're doing is helping them recognize, how do I know when I need to do something to take care of myself? And I'll say it's important to hold that this isn't just for parents. It's again, really important for the range of caregivers who are with kids. So parents are obviously in the trenches, right? But we have teachers who are with kids 8 hours a day, or as therapists, we can get our own buttons pushed. So a starting point for all of the adults who work with kids is to pay attention to our own emotional experience.
What can caregivers do to help take care of themselves?
Yeah, a starting point in taking care of yourself is giving yourself permission to feel what you feel. That again, it's hard to be a caregiver in whatever way that looks, whether that's a parent or a grandparent or, someone who's working with a child. And again, that sort of permission of it makes sense, of it being okay for me to have this response. That we have parents who come in and say, God, I just hate my kids sometimes, and that has to be okay, right? And the trick is, you don't want to sit in that all the time, and you don't want to feel it all of the time, but you have to give yourself permission that sometimes you're going to have those less pretty emotions and that they make sense. After that, what we really want people to do is have a repertoire of supports. We tend to think about in the pocket coping strategies, sort of call them. Those are the things that you pull out in the moment. So you're in that moment, you've just recognized that you're yelling and shouting and that's not your usual behavior. And you know that one of your in the pocket strategies is you take a breath and you walk into the bathroom and you shut the door for 5 minutes, assuming that everything is safe enough to do that, right? And you have sort of a range of things that you've tried out and you say, I know this is something that in that moment helps me take the breath and step back for a minute. We also want people to have ongoing self-care strategies. And these are the things that you do that kind of keep you steady in your life, that bring you some pleasure and give you some respite from the stress. And, often I'll have people, I hear this a lot, where caregivers say, I just don't have time. I don't have time to take care of myself. And the thing is I say, well, do you have time if your kid had an emergency and you had to make it into the doctor? Well, of course I would do that, right? And as much as it's important to make sure your child gets all the help they need, if a caregiver doesn't take care of themselves, they're not able to support that in their child. And so this is part of doing that work, is taking care of themselves. And I think, we got to be realistic in this, right? Not everyone can say, yes, I can take 3 hours every day to engage in, to go sit on the porch and sit in the sun, or to do some gardening or whatever else. So I think about, well, where can you take a 5-minute vacation? Right? I like that idea of the 5-minute, the 10-minute vacation in the middle of your day, where you say, I'm going to protect this 10 minutes for me, and here's what I'm going to do on that. And then beyond all the self-care stuff, we want people to have concrete resources and supports. And something that as providers we want to pay a lot of attention to is, what can people access and what can they realistically access, whether that's therapy or community-based supports, spiritual community. A lot of people get support from their church or their synagogue, but thinking about the places where someone can draw in friends, resources, other supportive people in their lives.
So when discussing attunement, you discussed the importance of a caregiver being able to read a child's cues, but that a secondary goal is really helping children to also be able to read their caregiver's cues. Can you talk a little bit more about that dynamic?
Sure. So let me say first what attunement is, okay? And attunement is really about being able to read. I think of it as sort of that message underneath the behavior. And, to me, a great example of this is with a pet who can't talk to you, right? Where you learn to figure out by their body language what they're communicating, or someone who you just know so well that they don't have to talk to you, by the way they walk in the door, right? Whether they're upset, whether they've had a good day or a hard day. And all of that is how we learn over time someone's language, and that language goes far beyond words. And when attunement works really well, it's very much a foundation for intimate relationship, and in every way that intimate relationship occurs. And the challenge is sometimes there are misattunements. Now, in every relationship, there's misattunements. There's moments when we miss the mark, right, where we misread something in someone else. But when we have a situation in which a child or adolescent has experienced a lot of relational danger in their lives, or betrayals or losses or abandonment, all of the ways that relationships don't go well, over time, as a way to protect themselves, they start looking for those cues that might happen again. And that means that the child may be, again, searching for signs that you're angry, or searching for signs that you're not interested in them, or that you don't care about them, or whatever else. And that's protective if they can pick it up early and take care of themselves. But sometimes they misread it. They expect to see it, and then they see it. So something as simple as an adult saying, you know, hold on a second, right? A child says, I need to talk to you. The adult says, hold on a second. What the child has just read at times in that is, I don't care about you. I'm not interested in what you have to say. So on the one hand, we have the adult who's trying to accurately read the child's communications. We have a child who is hopefully trying to read the adult's communications. But if you end up with a mismatch where the child is reacting to what they think they're seeing and responding to it, can make it harder for the adult to understand what's happening. And then you add, sometimes we have adults who've also been hurt in relationship, or who are protecting themselves in some way, or who've built up in a negative pattern maybe with this particular child, and so they're vigilant now to signs that something's gonna not go well in that relationship. And so we have this real clash happening in the relationship. And a lot of times when you break it down, what you find is that both sides are actually wanting the same thing, which is the relationship to go well. But they're so, in some ways, their brain is doing such a good job of taking care of them that it actually prevents them from having what they want. So one of our challenges in doing this work is helping people kind of bring that guard down a little bit and learn to read each other's language in a way that might be a little bit more accurate.
Can you give a couple examples of activities that a parent or family could do to help foster attunement?
Sure. This is where it gets, sort of fun to be creative in doing this work, because there's so many different things we can do to support caregivers and kids in learning how to read each other. Having said that, it's really hard work, often for the caregiver and the child, because it's vulnerable to feel like you're not reading your parent well or your child well, or to feel like you're being misread. So often the biggest thing we have to work on is that piece of vulnerability. What's it like to actually sit with each other and test out your theory of what you think is going on? Activities can be anything from the things we do in session. So with a younger kid and a parent, I might do games like feeling charades, where they try to guess what they're seeing in the other person. Someone acts something out and the child tries to guess, or the parent tries to guess. It's often a really good opportunity to look at where they're accurate, where they might be misreading, or to do check-ins about the week and ask the opposite. So ask the parent, what kind of stuff did you think your child might have been feeling this week? Ask the child, what kind of stuff do you think mom might have been feeling this week? And then again, look at why you thought that, what might have been going on, that sort of thing. We're helping each in some ways become a detective around the other, but with them both in the room often, so that they're helping each other and figuring out what is accurate and what isn't. I also like to pay a lot of attention to in-home activities, because getting to know each other can often be as simple as taking the time and space to hear what is going on in someone's life. So things like family meetings, having a ritual at the end of the day where people go around and talk about, here's something important that happened in my day, or I had a good day or a hard day, and not having the other person feel necessarily like they need to fix it so much as to hear it and to say, okay, it sounds like you had a really hard day, I'm sorry to hear that, and to kind of sit with that. Family communication boards, because sometimes you can't always have the family meeting, but you can have something where you walk in the house and each person can move a magnet, to show what kind of day they had, or something like that, or write a message to say what went on, so that people are building that interest in each other and really a curiosity about each other. And I feel like curiosity is kind of at the heart of attunement. The caregiver being curious about the child and curious about what's behind the behavior, the child learning over time to be curious about the caregiver. And when she's looks like this, is it because she hates me, or might something else be going on? And eventually it's the child being curious about themselves, which can take some time to get to.
Do you have any special advice for foster parents or adoptive parents who are working to build a stronger attachment to the children in their lives?
Sure. It's interesting because every caregiver is different, right? And so I think sometimes we want to say this is true for all biological parents, and this is true for all foster, this is true for all adoptive, and yet everyone brings something different to the table. Having said that, there are certainly different challenges in fostering or ultimately adopting a child, because you're starting from a different place in getting to know someone, and the child has a life that predates the life they had with you, right? And the family, the foster adoptive parents, have a life that predates the child, and that can have a lot of strengths in, you know, maybe holding different experiences so that you have different resources to build on. The child brings some resources, the family or caregivers bring some resources, but it also has its own particular challenges. And you know, I think one of the biggest challenges that I've seen is in some ways a lack of acknowledgement of those differences, that caregivers may bring their expectations about who a child is going to be. You know, most caregivers who go into fostering or looking to adopt a child go in with the best of intentions. They want to open their hearts and to love a child, and sometimes the assumption is just loving this child is going to be enough, and kids come with a lot of history and a lot of experiences that make that hard, including a lot of negative relationship experiences. And so there's often a mourning process that caregivers have to go through. And then there's really a getting to know this child. So there's the expectation, right, of who the child is going to be. We all kind of have that when we go into a relationship. We have this picture of who we think the other person is going to be. And then to really build a relationship, we have to get to know the actual person. And so, you know, one of the things I hold to be really important is there being this real getting to know you process on both sides of the caregivers getting to know who this child is. So it's not just the child learning the rules and the expectations and the traditions of the home, but it's the parents learning what's important to this child, what traditions are they used to, what rules are they used to, how do they understand relationship. It may be that in our family we, you know, have an expectation that you know, we do a lot of hugging, or we're very physical in our affection, and for this child that feels really threatening. And so if this child doesn't hug me, I worry that they're not affectionate, but it may be that she shows being affectionate in a different way. And I have to learn how to figure that out, how to read that. So there's this real mutual process of learning to read each other's language and knowing that it doesn't always look like you might expect it to.
For many foster or adoptive parents, it can feel like there are a lot of systems that, you know, are influencing their day-to-day life, and some of these systems can feel supportive and sometimes they can feel overwhelming. Can you talk a little bit more about that?
You know, this is true for so many kids who've experienced trauma. Is there are so many adults involved in their lives. It's partly why in our framework we talk about caregivers and not just parents, because there are so many adults. And for people who are in a parenting role, and this is actually true whether it's a biological parent who's involved in DCF in some way, in child welfare systems, or foster or adoptive parents who are very heavily often involved with systems. There's a lot of people telling them what to do and what they should do and what they shouldn't do, and looking at how they do it and whether they're doing it right. And when you feel like you're parenting under a microscope, there's really an additional layer of pressure and of stress there. I think it speaks to, in some ways, the real importance of the provider system paying attention to this, that we want to be working as a collaborative team. We want to be talking to each other. We want to make sure the parent always feels like a key part of the team. That's a real challenge for foster parents in particular, because they often have very little power. And it's easy, I think, for them to see themselves as in some ways a less important player in the mix. And yet they're the ones doing the day-to-day work with a child. And so they get left out of the treatment process a lot because we think, oh, this is temporary, right? And yet to me, it's crucial. You know, we've done a lot of work with programs that support foster parents, and there's such a linchpin in supporting a child's functioning, and we want to support the foster parents' functioning. So I think there's a shift in how we need to consider the role of the parent as part of the treatment team. And for that matter, the role of the child as part of the treatment team. This isn't us as a system doing to a child and family, but doing with.
What are some of the outcomes for children and families who have experienced traumatic stress?
Yeah, when we talk about trauma and its outcomes, we talk so much about what goes wrong, right? And of course we do, because trauma has the potential to be toxic, right? To development, to really impact a child's functioning in the world and an adult's functioning in the world. And the reality is there is so much inherent resilience in human beings, and it's at the heart of how I think about this work. It's at the heart of our framework, which is much less about reducing pathology or the bad things and much more about how we support children and adolescents and caregivers in sort of developing all the tools and skills and internal resources and external resources they need to lead really joyful, healthy lives. And I think we focus there because we have an absolute faith that people have that capacity, that everyone has the potential to do wonderful things for themselves in their lives, and that's going to look really different from person to person. We know just by the numbers, so many people have experienced trauma. It's not rare. It's not something that happens to only a few people. And human beings have a pretty remarkable capacity to, not just survive adversity, but to overcome and transform it. And it gets harder, right? The more layers of stress you have and the fewer resources you have, and that's hopefully where our supports come in. But ultimately, I always think I see a lot more resilience. I'm surprised by resilience much more than I'm surprised by adversity. So I think there's a lot of hope in this work.